Hey Jay.
Why, good morning, Natalie.
Good morning. Good morning.
No,
I
not
love
this
to sing
morning.
on the podcast. Good morning. Good morning. Sorry for everybody. I'm just now getting my voice back. I was sick for the last 2 weeks.
And that was such a blessing.
Oh,
Oh, did I say that?
I lost my voice for 5 days. And
Oh,
all JJ did was celebrate.
I
And
did. Had a
Jason
Oh
party.
my.
celebrated. I know, right? It was crazy. But you know what? Today's not about me, as every podcast is always about me. Um, so, but you know who today's about?
I give up. We have a guest. I'm so excited.
We have a guest, and we have a unique guest. And it's not just like she has such an interesting caregiver journey. But it's not just her. And, you know, we just had 3 sisters on. That tells you when our podcast is being recorded because the sisters were on. We had 3 sisters on. Jean has 8 other siblings. Like, holy
The cat
cow.
out. You just let the cat out of the bag.
I mean, she's got a baseball team that they're working with right now. And almost a football team. I'm not gonna lie to you. So, you know, we've got Jean on the show today, and I would love for you to tell folks about our sister in care.
Thank you, Natalie, for that introduction for me. Thank you. So today we have Jean Hartnett with us, and I'll start out by saying Jean is amazing.
Yes, she is.
She has over 30 years of executive experience serving the older adult population.
Did she start when she was like 9? Because she
did. She actually was 5.
Yeah.
So because she's only 35 right now.
Yeah, that's true.
She has been a frontline employee. She has been a healthcare executive. She's been a college professor, a consultant, and an advisor for health systems across the United States.
She's got to be tired.
I know. She founded Radical Sabbatical to help others turn adversity into advocacy. She understands the effects trauma can have on well-being and that recovery takes time. But with all of that, she has a caregiving story like all of our guests. And it starts, as Natalie said, with 8 brothers and sisters caring for their parents. And the problem was not, it was not that everyone agreed at the same time. So Jean says with all of her frontline and management experience, caregiving for her parents was one of the hardest things she's ever done. Jean, thank you so much for being here today. So I'm going to ask right off the bat, where are you in
birth order?
What's the birth order? Where are you?
Oh my goodness. So do you want me to go through the whole list?
No.
So I do it really fast. So it's Ronnie, Mary, Joy, Danny. Yep. Ronnie, Mary, Joy, Danny, Katie, Beth, Amy, Jenny, Jean. So I am the last of that.
Oh, she's
group.
the baby.
I'm the baby. Yes.
Are you all close in age, or is there like a wide span?
You know, I think so we have one set of Irish twins, if you're familiar with that term.
Yes,
so Irish twins are babies that are born with less than a year gap between their birth. So my first 2 siblings, Ronnie and Mary, are Irish twins. And then everyone else is kind of spaced by 2 years to 3 years. Yeah.
So you're still close. There, you know,
yes, we are. Yeah. Yes, we are. What's interesting about our family dynamic is that we have 2 generations that are part of our generation. So we've got the oldest set of brothers and sisters that are baby boomers, and then the last 3 of us in the family are Gen Xers. And I've thought a lot about how that generational gap, as it's called, really did impact the way that we view the world and view the world of caregiving. So it all connects. Like when you have as many people as I do in my family, it's its own sociological experiment that's very interesting to look at.
Well, and that's so interesting that you bring up the difference between baby boomers and Gen X, and we align with the Gen X population as well. And so it's interesting because your oldest siblings will have not had the same technology and the kind of experiences in the field. I mean, they literally go out and play outside until it gets dark and not have to worry about what happens to them, all the way to you've got technology with you. You know what I mean?
Yeah,
that's interesting.
I do.
And then how culturally some like the 80s music, some likes 90s. Personally, I'm the 70s kind of gal, but
I've always felt as the youngest, I have really benefited from my older brothers and sisters' experiences. When you talk about kind of the cultural zeitgeist of music and politics and just lifestyle in general, I think that, my older brothers and sisters for such a long time have been my heroes, every single one of them.
Wow.
And so I just have always admired the way that they've lived their lives and raised their children and have had careers. And they definitely, when you've got that many people in your family, we really are three families. I think about that dynamic as well as, mom and dad, when they were first starting out as a young couple, raising the first three was a very different parental experience than it was for me at the end as number 9.
They were exhausted by you. I mean, our mom and dad were exhausted by Emily, and she was just the third. I mean, they were like, just do whatever you want. If you survive, it's great. We've got 2 others.
Natalie, that is exactly the perspective I've always known about my parents. And even growing up, I recognized that there was that exhaustion, and I don't know that I ever put words to it. But I knew intuitively that they'd been through a lot. And it's not like when the other 8 older brothers and sisters left the house that mom and dad ceased to be parents, And so it just was, it's always been interesting to look at my family from the social worker perspective, which is what my background is. And really understand kind of like systems theory and family dynamics. And now I'm doing a deep dive into trauma professionally, which is just so fascinating to look at.
Oh yeah. If we had known about trauma when we were kids, we'd have been like, we'd have been calling CPS a lot earlier. So go ahead, Jay.
Well, no, you start. So what got you in? Because you started as a CNA, like that was you have a long career in healthcare, and you've worked all the way up to executive. You've worked with the government, but you started as a CNA. Did you always take care of people? Is that where your heart was, Jean? You were like, I want to be a caregiver. You've had all the stray dogs.
Yes. So let me set the stage in terms of the part of the country that I grew up in.
Okay.
So I'm a born and raised Nebraskan.
Wait, are you Catholic? And you can tell us if you're Catholic. I knew you were Catholic because there's no birth control.
Right.
The Baptists are all like, don't drink, but God, take birth control.
Lord, forgive us.
So yes, I grew up in a very Irish Catholic traditional family.
There you go.
In Northeast Nebraska. And I think for your listeners, everyone thinks of Nebraska as like this flat, barren state where there's nothing to look at from a landscape perspective. But I grew up in Northeast Nebraska we weren't right next to the Missouri River, but the Missouri River definitely carved out the landscape back in the day of the area of Nebraska that I grew up in. So Nebraska kind of looks like a little bit of Ireland. Where it's just endless views of the green grass meeting the blue sky and hilly farmland and wildlife all over the place. And so that is where I grew up. And with that, like all rural communities, individuals stayed at home as they aged. Most individuals stayed at home as they aged. So in my very small town of about 230 people, JJ, I would go as a young girl and visit people that I knew were elderly because I really enjoyed that experience. And I have a very, it's kind of part of family lore, if you will, that the reason why I got interested in it is that one time after church, we were driving home and my father at the time was renting land from an older woman by the name of Beat Hurley. And so she was probably in her 90s and lived on her own farmstead. And when mom and dad and I went in after church and my other brothers and sisters went in to pay the rent, Beat was sobbing at her window.
Oh,
And just like in her rocker, if you can imagine like an old farmhouse and like
Mhm.
the lace curtains and her just in her rocker, and she was crying, so like sobbing. And as a little girl, I'm like, she's like, that is just so much part of like what I remember
Mhm.
about what aging, as far as I knew it, looked like.
Mhm.
So because of that experience with Beat and just having that really burned on my memory, I started going house to house in Hubbard with my girlfriends, two of my girlfriends, who are still my girlfriends today. We just started visiting the elderly. And
Wow.
I just
wow.
loved that. I mean, because I don't know. I mean, there wasn't a lot to do in Hubbard, I'll be honest with you.
Well,
That's the name of it's 230 people. We
Yeah.
didn't,
well,
our
everybody knew
park,
everybody.
everybody knew everybody. Exactly.
Huh.
So that's kind of how I think it started early for me, JJ,
Yeah.
of really wanting and knowing that just a little bit of kindness and a little bit of happiness and a little bit of joy
Wow.
really does make a difference.
It does.
And so, yeah, I think it did start that early for me.
Mm. When everybody's older than you. Like if you think about it, you're the baby. And
Right.
so you've got everybody older and you're kind of looking forward and you're hanging out with people that are older than you, if you really think about it.
Right.
And so it makes perfect sense that you would naturally gravitate. I mean, we grew up, in our grandparents had a hardware, and I grew up in the hardware because my parents worked, and we'd go there every day after school. And I hung out, like all the older people hung out there. They're all retired, and they'd all give me a hard time, which I loved.
Right.
But I hung out with all older people, and
Yeah.
and I have such a respect, a reverence for my elders. And that's taught in the church. That was taught by our community. You respect your elders. Of course, you're not going to backtalk somebody who's older. I mean, you get a middle-aged person, you're probably backtalking.
Right.
Anybody over
Yeah.
65 with gray hair, you're not doing that. Like that is a hard deal breaker. That's so interesting. So do you think that, did your siblings, this is interesting because of dynamics as you guys get into caregiving, did your siblings help raise you more than your mom being the youngest?
I don't know if it was more than as much as it was in addition to.
So it's like a team
Yes.
raising.
Yes. Yes.
Yeah,
Yes.
because I didn't know if your mom, like, did your mom work? Did your dad, I mean, your dad worked, but did your mom work, or what was that look like?
So mom didn't work outside of the home for a while. So primarily the business of my family is agriculture or farming. So very much mom and dad were a dynamic duo in terms of building the farm. And so dad started out very small and eventually kind of grew and grew and grew based on the number of acres he acquired and purchased and planted corn and beans. At a time, we had cows and hogs, like 200 head of cattle, and I'm not sure how many head of hogs. So he was like a full-fledged farming operation.
Wow.
And mom really supported by being the household operator.
Yeah, she was COO of the household.
100%, managing all of the meals. Sometimes during planting season and harvest season, we did what's called put up lunches, where we would make sack lunches for the hired hands, the hired men. And so all of that organization, that planning, that multitasking, my mother was just amazing at it. And she cooked breakfast. We called it, our middle meal. Our noon meal isn't lunch in the country, it's dinner. And the evening meal is supper.
Supper.
Supper. So breakfast, dinner, and supper were things that she organized and made sure that we always had like a slab of beef or whatever, a roast or what have you, fine on the kitchen counter for tomorrow's meal. So I think I really learned from her kind of that multitasking ability of how do you keep so many balls in the air? And this is nursing home administration.
Right.
How do you keep so many important balls in the air at the same time and execute on them flawlessly?
Yeah.
Wow. That's interesting. So you go into CNA and then you start working your way up. So when does unpaid caregiving? Because you're doing paid caregiving at this point. I mean, I've been a paid caregiver in that sense. Like I look back at it now and running treatment facilities and making sure children are taken care of, whether it be foster homes or whatever. And you're doing paid work and you're working your way up the ladder. You're doing well for yourself, right?
Mm-hmm, mm-hmm.
And then when does caregiving family jump into your life? Like age kind of thing, if you don't mind.
No, not at all. So, like you said, Natalie, I started on the front line in 1988 and was a certified nursing assistant on the 3 to 11 shift while I was getting my bachelor's in social work. I moved to Capitol Hill, moved to DC and worked on Capitol Hill directly after graduating because
that's different from Nebraska.
It very much was. It very much was. Social work to me was health system change and social change. So I went macro level with my social work. And after my senator retired, then I looked into a master's program and got my master's program at GW, became a nursing home administrator, stayed in the field for a long time managing those facilities. And then in 2021, my mom had a stroke. And at that time, I had actually pivoted to a children's hospital here in Omaha and was the director of care coordination. So my team managed, I was a team of 80 social workers and nurse case managers that worked in all 3 areas of the hospital, inpatient, specialty clinic, and primary care. So it actually was a February afternoon or February morning, my sister calls me and tells me that my mom has collapsed in Walmart and they believe that she has a brain bleed and she was being life flighted to Omaha.
How old was your mom?
At the time, she was 83.
Okay. It gives me a kind of frame of reference. Okay, keep going.
Yes. So my mom was my dad's caregiver, even though they were both extremely cognitively intact. And mom was as independent as anyone. There was nothing from a medical perspective that was holding her back. My dad, on the other hand, had some mobility issues. But other than that, they were both still living very vibrant lives. But my mom was my dad's primary caregiver for those activities of daily living, the bathing, the dressing, and those types of things. Dad was fairly independent, but she assisted. And so when that occurred with her stroke, then Dad needed care because mom was going to be in the hospital for a number of weeks and probably in a rehabilitation hospital, which she did go to. And so someone needed to be there for Dad.
Yeah.
At the time, I was moving my daughter to Fort Worth. So I was actually in Fort Worth, Texas at the time that I got the call from my older sister saying mom was being life flighted to Omaha. So I just packed up whatever I had and off we went back to Nebraska and got into Omaha, Nebraska about 3 or 4 in the morning. And then about 8 in the morning, I'm in a parking lot at UNMC with an older brother and his wife. Really trying to decide now who's going to go home and take care of Dad. So I did that.
So here's a question. Sorry about that interrupting, Cal. Move.
No.
So where does everybody live? All the siblings at this point? Is everybody in Nebraska?
Not everybody is in Nebraska.
So how many are there?
About 4 or 5.
And then is everybody else fairly close by, or did they scatter to the 4 winds?
So, some, like one sister lived in Arizona, another sister lived in Colorado Springs, but all of us, the majority of us now were within driving distance to Hubbard. And some lived right next to mom and dad. I had a sister who lived right next to mom and dad.
So it made it easier. So everybody kind of did intermittent connections to check on mom and dad at that point. I'm assuming with 9, honestly, with your baseball team you've got going on, somebody is speaking to mom or dad every day. And did you all communicate like through text, like, hey, spoke to mom, or worried about dad, or mom seems down, you should call them? Because that's what JJ and I and Emily do. Like we all are like, we text message if we've talked to mom and kind of give a status update of like, mom's down, give her a call.
Right. We didn't consciously do that prior to mom's stroke.
Mhm.
But because I think all of us kind of had our own pattern of communicating with them.
Okay.
And so we felt like the check-ins were frequent enough between all 9 of us. And if there was something major going on, like if dad had a fever, or if something was going on with mom at one point, way back in the day had shingles. And so if it was like kind of those things where all of us needed to know, we absolutely stayed connected on that. But kind of the day-to-day stuff, I think, not necessarily.
Okay. So you guys are sitting in the parking lot, and you and another sibling decide that you're going to go move in with dad. No, it wasn't call a family meeting where everybody came together.
It really wasn't. And it wasn't a move-in situation so I was still on vacation for moving my daughter down to Fort Worth. So I was still officially on PTO. So I had some time off from work. And my older sister brought dad down to Omaha to see mom in the hospital the very next day. And so my brother and I are in the parking lot, and I said, I'm still on PTO. Why don't I take dad back to Hubbard and stay with him through the weekend, connect with my employer and let them know what's going on. And then when I get home to Hubbard with dad, I can start setting up some home health or private caregiving through the home insteads or the angel guardians of the world.
Yeah, right. Yeah.
And so that was kind of like plan A, that since I had the time off, I would just take dad to my townhome, pack up a bag, and go with him for that first weekend. So that's what I did.
Did anyone else, just out of curiosity, have a health background, the healthcare background? Any of your siblings?
Yes, we do. We have what's so interesting about our family is we've got a lawyer, we've got a CPA, we've got a PhD in genetics.
That's
we have
terribly
a nurse.
Convenient.
Yes, we have all the roles. And so between the woman, my sister who has her PhD in genetics, and my sister who is a nurse, and me with the administrative background, like the three of us probably had like the most, should you call it, discipline specific information and expertise on how to navigate this. So yeah, great question.
Oh, wow. That's interesting. So mom's in the hospital and she's going to go to rehab. You go home with dad. Everybody's like, good plan. Everybody stacked hands and they're like, break.
Yeah.
And then you go, and then what happens?
So I go, and the weekend was a great weekend. I mean, I'll be honest with you, my caregiving muscle memory is strong. And there is nothing like the 75-hour CNA course that I took in 1988 that there's everything in that course prepared me to continue as an adult to take care of older adults.
Yeah.
I mean, the mechanics of caring for someone really doesn't change. A bed bath is a bed bath. A transfer with a gait belt is a transfer with the gait belt. So I was really fortunate to have those skills. And they just came right back to me. And even as an administrator, I was very much a boots on the ground administrator. I loved being with the elders. And so doing it for dad it just seemed like a no-brainer and just really easy for me to do. So I felt like the weekend went really well. It was kind of who is going to be able to provide the care and assistance now that I have to go back to work, and what does that look like? So we were kind of scrambling a little bit, but from the most part, or in most cases, everyone stepped up. So between me and the sister that lives right by mom and dad, and the sister that was the PhD geneticist, and then the sister that was the nurse, there were a lot of people that raised their hand to come in and help.
Was there anybody who was like, yeah, I don't really want to do that? And I'm not talking about saying names, but was there one or two that was like, you all got this, just let me know what you need me to do, but really I'm here just kind of watching?
Yes, I think there was. I think what it was is, and that was here's the thing. It was like, I may not want to do the toileting of my father,
Right.
but I will do X, Y, and Z. Like, I'm here if you need.
Right.
And so we had opportunities where we really did need those that weren't exactly comfortable with the activities of daily living, the toileting, the dressing, the et cetera.
Right.
So that became hard because, some of us that had been doing it, we were getting really burnt out.
Yeah.
And even though once we were full swing family caregiving and we had a number of privately paid caregivers, there were still gaps in the schedule. And so, and again, we're caring for two people, not just one.
Yeah.
And I often tell people about my experience that caring for mom and dad, once I did decide to move in with them for a period of time, that there were times where I would meet the squad taking mom into the hospital as I'm bringing dad home. So it was this constant toggle on Highway 35 of like one going in with something acute that happened, bringing them home, implementing a discharge plan, changing the meds, filling the med cassettes, and then get that one stable. And then the other one has an acute episode. And so then they go into the hospital. And so it was just kind of this revolving door. And how does the trick of it is how do you keep everybody updated on all of the changes that are happening in their care plan in real time?
So so you just said, okay, so mom comes home, you all are figured out a plan that includes a combination of you guys providing support and paid care. Because I'm assuming there's no insurance benefit at this point that is paying for it.
That's such a great question. And I think one of the things that I loved about my experience, just to toot my own horn, is knowing what Medicare would cover and knowing how to maximize their days in a rehab hospital or how to set up, home health Medicare paid for after a hospital discharge. So that kind of mechanics of knowing Medicare as well as I do really did benefit mom and dad because I knew what teams could come in. I forget your question now.
No,
Natalie.
that's okay.
No,
that's okay. No, because I think that's important. You have insider, like I have a little bit of insider. You had more insider than I did. Like I understand regulations and things like that. And I'm the primary that talks to the facility with our mom, whether it be skilled nursing or assisted living and things like that. I understand regulations. And the funding part was harder for us. And so you're fluent in funding because you knew how assisted living, skilled nursing facilities were funded. And you've also been in a hospital setting where you know what, as a discharge planning, and you knew that is like golden nugget information that I think our listeners don't really know. Like, I didn't even know my benefit had that. Most people don't understand their benefit.
No, they don't. They don't. And they don't know how, as a customer, to really push to keep a person in the hospital or to keep the person in rehab. Like to say, there are so many times, Natalie and JJ, that I said to the hospital discharge planner, it is not safe for mom or dad to come home, which meant, once you say the safety word, that buys you a little bit of time. And so it's things like that. It's understanding that when an older adult is admitted to a hospital, they must be admitted, not on observation, in order for those 3 midnights to qualify you for Medicare. So a lot of things that happen in hospitals now is that an older adult will come in, they'll admit them on observation, which means that clock for Medicare, those 3 midnight stays that you need to have doesn't start when you're on observation. So I always tell families, if your person is in the hospital, they may be in a hospital, but they may not be admitted to the hospital. And it's very important for Medicare purposes and reimbursement that they're actually admitted. So that's a key question that nobody knows how to ask. Nobody knows to ask.
Nobody would think, but that's a regulation. That is, and that nobody's saying, and that is not freely given. That is not
No.
freely given
No.
by anybody.
No.
And and here's the thing, to all of our MCOs and our health plans, we love you. We know you want to cover cost. However, the goal is to keep people out of higher levels of care, like skilled nursing.
Right.
And so if you pay for the front end of the hospital stay to allow the family to prepare the home from a safety standpoint for them to remain in the community longer, because we know health outcomes for individuals in the community are better, but they're only better if the family and the caregivers and the plan is well done. If you are just if you're in your home, and we think about our mom, that mom was shuffling through people and trying to, rob Peter to pay Paul to make all the terms meet. And I think that's the hard part. Are you actually doing the person a disservice by keeping them in the community if you don't have a good community plan?
Right. Right.
Just being in the community doesn't make it good, because loneliness impacts and isolation impacts a person's overall health and well-being.
Yes. 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 I think that's all that you're saying is exactly right. And it is unfortunate that it is so difficult to explain all of this, because when families are involved in this, they are in crisis. So they are not really able, when you are learning really idiosyncratic type of information like Medicare regulations, you've got to be in a time and a space where you're able to learn that. When you're in crisis, you're just constantly reacting to things. And, when the discharge planner calls you and says, we're ready to discharge your dad, and it's 7:00 in the morning and you have no backup plan, what is that language and what does that conversation look like, so you can buy yourself a couple of days?
That's true. That's so true, because the problem is it's like you're talking to the discharge planner intermittently. It's the day that they call you and it's really the rubber hits the road and you're like, oh crap.
Right.
I'm not ready to bring them home yet.
Yeah.
And I don't want the hospitals to be like, well, what have you been doing the whole time? And you're like, well, I've been in crisis. I've been surviving over here for a sec.
Right.
So, I think there's so much there. I think that's such a good point. We haven't hit on that before.
Yeah. So Jean, your mom, she had the stroke, but how long was it before you moved in? Because I want to make sure that we get into
that's true.
You, because how long was it before you decided to move in?
So we did almost a year of family caregiving between people that could do a tour of duty, I called it. For me, it was going on FMLA and talking to my boss and saying, this is what I need to do. And her saying, do whatever you need to do, Jean.
Wow.
Yes. Oh my gosh.
That's a blessing.
Oh, I was so blessed. I've got to give a shout out to Children's Hospital and Medical Center here in Omaha, because they support employees and they support family caregiving employees.
Yeah.
So when I talked to Megan about it, we went through the normal process of me applying for FMLA. Of course, I got it. So when mom was discharged, my sister nurse, my sister that is a nurse, she and I kind of did a tandem schedule where I think we did a week at a time or 2 weeks at a time. And then we switched.
Yeah.
And so we were there 24/7 right after the stroke. I picked up mom from Madonna Rehabilitation Hospital here in Omaha. We drove home, and then boom, I was caregiving for mom and dad. Did kind of that 2 weeks, because it was important to me that I did the post-discharge caregiving for mom, because I know if you really aren't paying attention to things post-discharge, when you get back home, at least for the first 8 to 10 days, there could be a hospital readmission or there could be some type of event that would happen that would take mom back to ground zero, and all the progress that she had made in rehab would be lost. So I was very cognizant of that. So that's kind of why I signed up for that first tour of duty.
Yeah.
So my sister Katie and I did that we said to our other siblings, we're going to do this for a month just to see what that burden of care is like. And then after a month, let us report out with mom and dad present on a Zoom call to all 9 of you and 11 of us, and talk about what we need to do next. Like, how independent will mom be at home? How independent will dad be? And so we kind of even had a pre-call and said, who wants to join this meeting? And so there were only maybe a handful of people who wanted to join, and there was no harm or no foul for those who didn't. But as the call event date got closer, more people wanted to join. And unfortunately, not all got the call information. Some believe it was withheld from them on a purposeful basis, while others of us were not malicious like that.
Right.
Yeah.
So there were people that that didn't want to be on the call initially, that then wanted to be on the call, but didn't get the call-in information. The call happened, and that's kind of where our disconnect started.
Oh, wow.
Where people were starting to think that even though Katie and I had done a month's worth of care and we were coming together to plan with mom and dad's voice what we ought to do next, people started to feel excluded. And unfortunately, that's kind of where things started to unravel in terms of a communication standpoint.
Hey, ladies, I need to interrupt for just a second to share about the Sisterhood membership. It's basically a sale every day. And the best part, it's free. Here's the details. We're partnering with our friends at Benefit Hub and other care partners to save you money. With over 200,000 participating companies across the US and abroad, you'll find discounts at your favorite local stores, huge savings on vacations, amazing deals on home, auto, and supplemental insurances, and everything in between. Go to confessionsofareluctantcaregiver.com to sign up, and then definitely tell your friends about it. They can join too. Trust me, there's a discount for everyone. And don't forget, it's free. Okay, back to confessing.
Wow. Wow.
So, and then I know that you've mentioned to us offline, off the podcast, that there were folks who said your parents should be a part of the decision-making process. And some said they're not at a place to be able to do that. And how does that get resolved? Because JJ and Emily and I have a natural order. We typically follow what JJ says, and then, but we always give our voice, but we always end up leaning into what we all can come to an agreement, even when we don't agree. We can come and say, yes, we all agree to this. We support this. We will go forward as a 2-parent, 3-parent family to our mom.
Right. Oh, that's such a good analogy. 3-parent family to your mom. Yes. So I think what happened, mom and dad have always expressed their desire to be their own people, to make their own decisions, and to be the king and queen of their home. And so there were some things like that should have happened earlier from a preventive standpoint, particularly with my dad, that he just didn't want to do. And
do you mind to share like what exactly?
Yes.
What would have been easier?
Getting a little bit more aggressive to treat kidney disease would have been advantageous for him, and talking to the nephrologist and having the nephrologist recommending, a course of treatment that he didn't want to do. And when you look at that from a medical standpoint, so my sister, who's just so experienced and just so well read on the medical piece, it was really advocating that he do those preventive things so that the kidney disease would, it wasn't going to eradicate, but at least it could be managed in a better way. But dad didn't want to do that. There are different things, the little things like getting mom to drink or eat, and getting, having her wear a gait belt. It's just those really nuanced kind of decision-making types of things. One of the things that we had when we were struggling for caregivers, we found a lot of really great caregivers in the community. And when I was home with mom and dad, I would interview them with mom and dad. okay, so this caregiver's coming in. She was a recommendation from the social worker who followed dad after his hospital stay. Let's interview her.
Yeah.
So mom and dad would interview our very first caregiver. They said, yes, we're going to hire her. And then we set that up. But there were other people, even with all the caregivers, privately paid caregivers we had that we found on a private basis, not through an agency. We still had gaps in the schedule, even with family caregivers. So we've got in a whole army, like providing 24/7 care for my mom and dad. And there were people in our small town, people that would have been neighbors or people that belonged to our parish that we said, hey, Dad, could we have Betty come in for the afternoon, and they didn't want to allow that. So being able to really let them make those decisions, I think became difficult because we then behind the scenes had to figure out how to fill in that shift or those hours of time.
Let me ask you a question, Jane.
Yeah,
sorry, Natalie. Let me ask you a question, because this has been a when your dad, you talk about your dad, and your mom, they were the king and the queen of the castle. When you're in and you're doing those daily care, how did that work? Because you've totally switched roles. I mean, you are the parent now. You're doing baths. I'm assuming you're really having to take some care steps, that, especially with your dad, but also with your mom, because our mom was really, when we got into incontinence issues, she needs help with the showers, things like that. It became uncomfortable. But it also, it took away a lot of her
dignity.
It was a pride. It was a dignity thing.
It's a dignity thing.
How did that, with them being king of the castle, how did that reverse your all's role? How did you all work with that?
Well, for my dad, I think it seemed a little easier because he had been having it done with him by mom.
Yeah.
And also dad had a privately paid physical therapist that worked with him regularly.
Okay.
And so he was kind of accustomed to acquiescing and negotiating what's comfortable for me and what isn't comfortable for me.
Got it.
And so what I always ensured that I did, just like trying to treat dad as if he were a gentleman that I was caring for in the nursing home, was to ask him, first of all, what are your preferences? What do you want to eat? When do you want to take your shower? What do you want to shave today? And then when does that work for you? And then as we're setting up that task, hey, Dad, I'm setting up this spa in the bathroom and it's shower day. And what happened for a while is that it felt like Dad and I would take a shower together because I was so unschooled and I would get so wet as well.
Yeah.
And so, it was just, I don't know how it's very difficult to express how you continue to provide that dignity when it's your parents. But for me, I find caregiving to be such an art.
Yeah.
And I find the touch and the, where it's therapeutic or it's task driven or whatever, there's such a beauty in it that I just brought that beauty to it. It was, Dad and I would talk during the shave and, when he had his teeth out, it was hard to shave his upper lip. So I'm like, put your tongue in your upper lip. And, I would always say, this is like Whoopi Goldberg in The Color Purple when she's got the knife to her husband's neck. Dad, here I am with a straight edge trying to shave you. So we had lots of opportunities to laugh and
I think it's so interesting that you say that, because you took it from you took the personal side out of it, yet made sure it still was there. You know what I mean? Like it becomes like, because I think we talk about this. It would be so much. We're glad that, I hate to say this, we're glad that it's our mom and not our dad, because I don't want to bathe my dad. That makes me feel very uncomfortable because you're not allowed in the bathroom when dad was in the bathroom. And so but we are girls, and with our mom, it was no holds barred. It's sharing everything. And so, it's like, oh, we all got the same things. And so I think that would be hard. Because for my mom, I'm like, whatever, you just get in the middle of it. But you were trained. Yeah, I come back to that you were trained. Yeah. And I think about, there's new legislation coming through for training for caregivers. And I think, gosh, what a blessing that people don't know how much training could really help the
Change.
relationship and change the trajectory of how well you'll be able to stay in a certain level of care, whether it's the home or even assisted living, and to stay away from skilled nursing. Because there's a difference between independent living, skilled nursing, and assisted living, that sort of thing. So you get to this point, and your mom and your dad, if respectfully, who passed first?
My father passed first.
So, and then, so how long did you care for your mom and dad together before your dad passed?
Oh gosh. So if I moved, it was a solid month or 6 weeks about. So there was a time in February of 2022. Was it 2022? I get my years mixed up, but almost a year after mom's stroke.
Okay.
Where I was home for a tour of duty, and I came back in Hubbard, and I came back to Omaha, and I woke up and I just said, oh, I think I need to be there. Like, be there. I'm there, but I get to come home for a week of respite or whatever it was at the time. But I think I need to go. So I called them, and Dad answered the phone. I said, Dad, what would it be like if I moved home? Like, I just come with my cat and I live there, and we don't put any time frame on it. We just figure it out as we go.
Yeah.
And so he was, oh, that'd be great. Yes, let's do it. You know, Mom was all on board. So I literally just went into my room. I'd gotten home late the night before. So between Hubbard and Omaha, it's about a 2-hour drive. So I had gotten home the night before, and I just hadn't unpacked yet. So I just like zipped my suitcase up with all my dirty clothes and everything that I would take there. And I just drove. I just like got in the car and drove.
Wow.
And so you moved home, and then it was how long before your dad passed?
Within a month to 6 weeks. Yeah, that was pretty heavy duty stuff because he was in the hospital. He was willing to try dialysis. And so we needed to figure out the dialysis schedule. So, you know, if Hubbard is a rural community about a half an hour away from the dialysis center, and he needs to go 3 days a week, what transportation place is going to do that? I told my brothers and sisters, we don't want to rely on transportation like the home medical. Let's rent a van that is wheelchair accessible. I will train all of the caregivers on that van. And so each of the caregivers that we had, I would have them in Dad's wheelchair. Dad's still in the hospital. Have them in Dad's wheelchair. I would strap them in and drive them to the farm to say, this is how it sounds back there. Like, it sounds like you're in a tin can. So if you think my dad can hear you, he can't. So then when we got to my farm, or Dad's farm, not my farm, Dad's farm, then we'd switch roles. And I had them strap me in and drive me. And I did that with the six or so caregivers that we had.
Wow.
So that was van training. Then Dad became non-weight bearing. So I had to procure a specific Hoyer lift that would roll on my mom's carpet. My mom's carpet was about that thick.
Yeah, she got the full shag.
Yeah, yes. So the little tiny wheels that's part of a Hoyer lift would not move on that carpet. So I had to get a hybrid lift situation where I went to the durable medical equipment place, and I tried out different slings and I tried out different lifts to see how we could move Dad from place to place, from his room to the main area. Again, I did training with all of the caregivers. Let me strap you in this Hoyer lift sling. Let me get you up on the sit stand lift. Let me roll you to the chair. So it was just that what we call in long-term care is a return demonstration. You do it to me, and I want to do it to you, so you know how Dad feels when he's in the sling. So those are just a couple of examples of kind of like getting the home ready.
So I do have, like, I want to make sure that I get into this because I always feel like we miss this. Jean, you have a life, and I heard you say a daughter and the cat. We're like dogs, cats. What is, you have given your life to this, and that your parents, and you've given up a portion of your life. Thank the Lord you have FMLA. Where's your mindset? because you're taking care, you've got to be tired.
You're running your facility, and FYI, the facility is your parents' home. Let's just be very clear.
Yeah.
Like, you are not normal. Okay.
You're like a superhero.
You are clearly running a skill. Cause I almost asked you, did you all ever think about putting your parents in a skilled nursing facility? And I actually think probably you might have thought about it, but the answer would be no, because you're running your own skilled nursing facility with your parents.
We definitely thought about it, but it wouldn't have been an option. It's not what mom and dad ever wanted. But we talked about from the very beginning, even after Katie and I completed that first month after mom's stroke, that what Katie and I did is not sustainable.
Yeah.
But we attempted to make it sustainable. So we continually talked about how it wasn't sustainable, but we kept doing it. And I think that's what caregivers do.
Yes.
They know that this is not what's best for them as caregivers, but you do it. I did it because I knew how. And I did it, I talk about vacillating between FOMO and JOMO. So the fear of missing out when I wasn't there, and the joy of missing out, or the fear of missing out when I wasn't there, and the joy of missing out sometimes when I did come home for respite. Because I was always afraid, not that my brothers and sisters didn't, I did what I call handoff PowerPoints to my brothers and sisters. So I would take pictures, and I did like 10 slides of the caregivers filming me on how to do the Hoyer lift, and setting up what I called reflective rounds with mom and dad, because my brother's a deacon, and I thought it would be his way to be a part of the caregiving team. And mom and dad were just such great people of faith that we would do Zoom calls with my brother, and he would read scripture.
Wow.
Everybody had their role.
Yes.
It sounds like everybody had their role.
Yeah.
And I love FOMO and JOMO.
You still haven't said what is going on
with your personal life.
You.
Like,
where are you physically and mentally?
Are you taking care of yourself?
Yeah.
I try as much as caregivers do. I think I did. I did advocate for myself and setting those boundaries. At the time, Natalie and JJ, I was in a yoga teacher training certification.
Yeah.
So I had to go back to Omaha once a month for a all day Saturday, all day Sunday yoga teacher trainer certification, and my sisters filled in while I needed to do that.
Yeah.
And I also had to take classes. And so the instructors at the studio allowed me to take them online. So I would get up around 4:30, 5 in the morning and do a yoga video. And that was part of my certification. Write the notes, because if you weren't going to be in the studio for the teachers to watch you, you had to prove that you had taken it.
Yeah.
So I had to take the class and then write some class notes on what I experienced in my body.
Mm-hmm.
And I am not kidding you. That yoga teacher training certification and doing yoga throughout saved my life. Hands down. Hands down.
So I know as you've progressed through this, and there's so many of you all, there's 9, and there are, and for me, I know there are spouses involved with us as well. So there's a lot of opinions out there. So, and you've got, I guess, how long was the total for, respectfully, how long was between your mom's stroke and then your mother passed away as well?
Yeah. So mom's stroke was in February, and then she passed away in July in the next year.
Okay.
So your parents, your mom and dad, passed within a couple of months of each other.
They did. Dad died in March, and mom died in July. Yep.
Yeah.
Yes. So it was about a year and some change for caring for them.
Yeah. So during that time, I know there's a lot of opinions going on.
Sure.
So how did you all make it through? Where are you? I mean, there's the before, we talked about before, like probably family reunions, y'all are having dinner together because your big
Normal
Catholic family maybe, but where were you? Where were you? Because I know there's, discussion about mom and dad should be, we should have this treatment. And then what about now? Like how has everything progressed?
I think we are in the middle of figuring that out.
Yeah.
We actually, it's not uncommon for some siblings to be closer to other siblings, whether it's based on age or based on gender or based on if they have kids that are the same age, the grandkids. And so I feel like, honestly, if I were to say where I'm at right now with my brothers and sisters, is really trying to understand them from a grief perspective.
Oh, yeah.
That we're all still grieving.
Mm-hmm.
And we're grieving a lot of things. Part of grief is what is called complex grief, is grieving what should have happened but didn't.
Oh.
And so I feel as though my story is that I feel like we're all trying to figure that out, like how we do continue to be a family and to move forward. And I get very optimistic about it because it may not be great now, but it doesn't mean that it can't be in the future. Like, how cool would it be to really reimagine our family and what we want our family's legacy to be? Now, I wouldn't say that anyone's interested in having that conversation right now, but maybe with time, JJ, they will want to.
Yeah.
And when we were having our difficult conversations, I'm a huge advocate of mediators. I'm a huge advocate of bringing in third-party people that can help you have those difficult conversations. That was a recommendation that never really took hold. And so I'm wondering if, there's still an opportunity to have those facilitated conversations. But I think we need what I call some composting time.
Yeah.
We need some time to sit and compost and decide, how do I feel about this? And how do I move beyond my parents' caregiving experience and relate to one another?
That the family legacy part you just said, and reimagining what we want life to be like, because I think so many people struggle. I remember when our grandmother died, and then what happened with the family. Like today, I think it's today, September 13th, our grandfather died. Our dad's dad died several years ago. And so I think, and then our grandmother died a couple of years ago, his wife on my dad's side. Like my grandparents on my mom's side have been deceased for a long time. And it's, how does the family heal from that? And I'm going to tell you exactly what you're saying. There was, after my grandmother died, there was so much unrest between the siblings. And because my dad had passed, my dad was the oldest. And I think there was even grief for wishing that my dad was there to lead the siblings. My dad was the natural leader of all the siblings. And so if you think, and it's taking them, but I see even through, it's so simple, it's through Facebook posts and things like that, you see the moving on and how do we find joy again? And how do we find joy in each other?
Right.
And it doesn't mean because our parents are gone, we stop being siblings, that our lives now scatter to the winds and we take our own respective families. And because why would we want to do that? We're built for relationship.
Yeah.
We're built for our tribes. And there's no reason to not keep our tribe going. You've got a baseball team. Keep your tribe going.
Yeah, I totally agree. And I think I personally don't want to rush anything with anyone.
No,
and
it takes time.
It does take time. So what my contribution is to continue to work on myself and to continue to integrate the experiences that I had as a family caregiver, and digging deeper, into the practice of yoga, and digging deeper into the science of trauma and resilience, and really understanding what's happening in my brain and body, and extrapolate it to my family, but then other families that are going through this exact same thing. It's really interesting to look at the interplay of how family history does impact family dynamics.
Yes.
And
I was getting ready to say, Jean, we didn't talk about childhood and growing up, and we're not going necessarily there, but you didn't have the easiest of childhoods. As your mom is a COO of the household company, you know, your parents were, and I see your parents as like what I visualize is like really like they're farmers, they're strong, very independent, strong-willed, very belief in their beliefs.
Right.
And knew what they wanted and probably knew what they wanted for their children. You all are very successful. I mean, honestly, you've got you've got the whole continuum of employment and so professions. And so I think it's so important for people to realize and think about how their past experiences impact their ability to care.
Absolutely. Absolutely, Natalie. And I think part of what you're referring to with my mother and me is that, you know, I had an unplanned pregnancy when I was 16 and lived at home. I was the last one, so there weren't other siblings there. And it was through that process where mom and I's relationship became a little bit difficult. Mm-hmm. But I didn't see it as difficult until I became an adult and started taking care of her.
Yeah.
So the piece that I'm working on is exactly what you're talking about, which is healing that intergenerational trauma. Mm-hmm. and how mom related to me based on how her mother related to her. Mm-hmm. And I have to tell you, I have such compassion for, if I look at my parents as if they were a social worker's case study, they're amazing individuals who overcame a lot of adversity, personal adversity. Mm-hmm. And they raised really great, not really wonderful kids. But it is being very honest about some of the nuances of that mother-daughter relationship so that I can in turn be a great mother to my child, who's not really a child. She's 36 and we reunited as birth mother and daughter about 5 years ago. So how do I look at my relationship with my mom and all the things that we've been through and learn from it, heal from it, and then move on and have this beautiful relationship with my daughter.
I love that. I appreciate you sharing that because you don't have to. You didn't have to. And I think, but I think that we all have so much stuff in our past, and it's, you know, the What Happened to You book by Bruce Perry and Oprah, where in the very last, and it's so heart-wrenching, where she talks about where she had to forgive her mother for her. Not for her mother. She didn't give forgiveness. She didn't forgive her mother because she wanted her mother. No, I forgive you. It was, I have to forgive the things that we can't change for myself so I can move on. And I think you're right about the brain body connection. I think where you talk about doing yoga and how that's so healing. And so I know we are so way over our time, but we don't even care because we're going to edit. Sorry, people. We'll have bonus content where we have to cut stuff out. Jean is like, you know,
I feel like
church again. She took us to church again.
Yeah.
Oh, you guys.
Yeah.
I just got the chills.
Yeah. Well, I think for us, and it's something that we didn't even get an opportunity to talk about, but it is about the family dynamics and how it so impacts your future. And I think caregivers don't give themselves the break to realize that. You know, even, you know, tones or reactions, just very basic things that you have when someone says something as simple as, "Hey, could you hand me the remote control?" And, you know,
and you can go to hell.
Yeah.
Right.
It's just the background of what that dynamic of childhood or your teen years impacts so much. And so for that, you know, caregivers just need to recognize that it's just not about the moment. There's so much packed into the background. So.
I think that's exactly right. And the more that I learn about the central nervous system and regulating yourself and being able to really understand not just what you're feeling, but what yoga teaches you is to pay attention to the sensations.
Absolutely.
So how does anger show up in your body? How does fear show up in your body? How does sadness show up in your body? And I did a lot because if I came off a tour of duty of caring for mom and dad, I typically had a lot of back body issues. And I don't mean my back hurt because I was lifting them or repositioning them. I mean my lungs, and your lungs hang in your back body. my lungs always ache, because I think that what I connected through meditation is I always felt like the breath was being taken out of me during caregiving. So once the lungs started to hurt, then I knew it was time to come home and give myself a lot of self-love. I'm not even talking self-care. I'm talking self-love.
Yeah.
And some of the things that I would do, I would just imagine, all right, you're laying on the floor and it's sunny out, and what your back body is in so much pain. Why don't you start thinking about people, if you're laying like this on the floor, all the people that are spooning you, figuratively, that are supporting you. So I would do those mental exercises to really help me physically feel better.
Yeah. Yeah, I think definitely folks have got to, you really need to be aware of your body and what it's telling you. And we aren't taught that as children. We aren't taught, we always have, anger comes out and this is what the sensation is. There's so much need there. So there's so much information out there, and definitely we could put more information about mind, body and brain body awareness. And so
are you ready?
I'm going to stop us, Jay.
I'm ready. Let's go.
So over, and I don't even care.
Yeah,
so,
I'm ready. Let's do it.
Like, Jean, you're such a blessing. JJ, it's time for sister questions.
I have so many questions. That's the problem.
You only get one. Suck it up.
Okay. So I'm like, okay, I have like all these questions about her childhood and everything. So I have a serious question. So here it is, because of your background. Do you feel like there was grief before your parents passed?
Good question.
Were
you grieving before?
During the caregiving process? Absolutely.
Is that okay?
My God. Is that okay?
Yeah.
To grieve while you're yes.
Yeah. There's so many people that say, is that a real feeling?
Oh, it is. Absolutely. Okay. I mean, it's complex grief. Actually what it is, it's anticipatory grief. I mean, that's a thing. It's going to happen.
Yeah.
And it's like, it's the when. And so for sure. And that anticipatory grief shows up differently than after death grief. Anticipatory grief is like an anxiety driven type of grief. Whereas after mom and dad passed away, it was more of a sadness type of grief. Yeah. So yeah, I think grief is one of those emotions. Brene Brown has her wonderful book called Atlas of the Heart. She could do a whole book on, Atlas of grief, honestly.
Yeah. No, I totally agree with that. I'm going to go completely opposite, because we've been very serious in this podcast.
Hit it, Natalie.
But it's been so good.
Yes.
I need to know what your favorite guilty pleasure is. What is the favorite thing that you do for yourself that is just like, I ain't sharing it with nobody. I'll even go to the bathroom and do it by myself.
I'll hide.
My guilty pleasure is body work. So body work by meaning I do what's called Heller work.
Okay.
So Heller work is a type of massage that helps to restructure your body in the way that you move. So if in yoga, we know that everything's connected from your tippy toes all the way to the top of your head. A Heller worker will look at your body and say, okay, what's misaligned? Like, how do we move that fascia around so that your hips and your knees and your ankles and your feet and everything moves as if you are a graceful swan? So after caregiving, as you can imagine, I was a crunched up can. And so, that's how my body felt in spite of all the yoga I was doing. So Heller work really gets those kinks out. And while you're on the table with your Heller worker, you're doing somatic dialogue. And what somatic dialogue is basically, okay, what's coming up for you as I'm working on your hips? What's coming up for you as I'm working on your neck? So that's my guilty pleasure. And
isn't that crazy?
I love it.
I was thinking something completely different. It was not, Bradley Cooper. And you're like, oh no, I want to be with myself.
Well, you're taking care of yourself, and I love that.
I love it.
Jean,
and we're
thank you
put a
so
link
much.
to Heller work. I think we need to put a link to that because that's something that people won't realize
Is a thing.
Really what it is.
I'm going to look it up when we get done.
I had never heard of it, Jean, and I've been in the field a long time. And so the combination of the massage with the somatic kind of discussion point, that is so important, because what it is you're putting words to your body's feelings and emotions that's coming out.
Exactly.
So that's what it is. It's beautiful. Jean, we love you. We love you.
Love you.
Thank you so much.
I do. Oh, you're welcome. You know, when I saw the two of you in Roanoke last year, oh my gosh, it just broke my heart because the three of you are so close. And at the time, our sisters, our family was figuring things out. We still are. But I'm hopeful that we will be like JJ and Natalie at some point again. Yeah. I really do think that can happen.
Yeah. Well, guys, thank you so much for listening in. And until we confess in it again, we will put extra content on the podcast. So we will, when you go to this is definitely over an hour. And so we have to keep it within a certain frame. So we just want to let everybody know we're going to put extra content so that you get to hear the full interview with Jean, because she is a blessing. So
you guys, I love you.
Thanks so much. Jean. Until we confess again. Thanks so much.
Bye-bye.